This presentation will cover the topic of immobility in Canadian children and youth and its link to obesity and the development of chronic diseases in adults. Immobility in children and youth is associated with obesity and the development of chronic diseases in adults, creating a threat to public health. Immobility is a lack of independent, purposeful physical body movement. In Canada, 1 in 3 adolescents are obese, and the obesity rates for children and adolescents nearly tripled in the last 30 years.
My name's Margaret. As you can see, I'm obese. I've been obese my whole life. I was a fat child. And now I have diabetes. I have trouble walking and my knees are sore. I get sores on my feet sometimes that just don't heal. And when I visited my doctor last, he told me that I was at higher risk because of my weight for cancer and strokes. This is what I get for my obesity.
Think back to your childhood and how often you played outside. Reflecting on past generations reveals a significant shift towards indoor lifestyles, contributing to health impacts. The recent pandemic further reduced physical activity, with 30.1% of Canadian adolescents now overweight or obese. There's also been a clear rise in adolescents aged 12 to 17 in BMI from 2005 to 2022. In immobility is linked to excessive screen time, online socialization, and suburban living, reducing physical activity like walking or biking to school. Childhood immobility is a global issue. In Canada, efforts to reduce childhood obesity rates include educational campaigns, community programs, and policies like the Daily Physical Activity Policy for schools, aiming to increase activity among youth. Additionally, there are strategies that target early identification and action addressing childhood obesity. Childhood obesity can lead to numerous chronic conditions in adulthood, burdening healthcare systems. In Canada, chronic diseases account for 89% of all deaths, emphasizing the need for preventative measures. Public health utilizes 5 levels of health prevention, focusing on promoting physical activity and healthy lifestyles. Strategies include public awareness campaigns, school-based programs, community incentives, and targeted intervention for those at risk.
When I was a fat child, I didn't like it because I was a fat kid. And I thought about how people looked at me and how I felt about my body image. But no one told me. No one told me that when I got into my 60s that I was going to have all these health problems. It's so hard now knowing this. If I had known that as a child, I might have cared more. I might have done the things that I was told I needed to do to control my weight. If I had known it was going to affect my ability to get around and my health and possibly my longevity. I've got grandchildren. I want to see them grow up, and I don't know if I will.
Public health professionals should raise awareness about the dangers of immobility and promote physical activity through programs such as participation, utilizing screen time for exercise, and enhancing physical education in schools are key steps. Community and environmental strategies are also vital. Having accessible and safe options to walk, ride bikes, and run to encourage a more active lifestyle. Public health's role in promoting physical activity is essential to combat the effects of immobility. By fostering environments that encourage movement and implementing comprehensive programs, we can address childhood obesity and secure a healthier future for all Canadian children.